Steele. Today I want to talk to you about gastroesophageal reflux disease, GERD. Unfortunately, as we get older, me included, included just like me, all of us start experiencing some type of, most of us, I should say, reflux disease. And the two most common reasons are one, besides getting older, of course, is that as we get older, our tissues, for instance, our skin, becomes thinner. That's a structural change. But there is also a functional change that we have. The openings and closing of certain areas because of time tend not to do his work anymore, to do their work anymore. So one of the openings is your lower esophageal sphincter, the real opening that is in your esophagus that becomes a little bit lax. It doesn't close as good as it used to. And I said, just like your skin becomes thinner, I'm talking about the mucosa inside your stomach. It becomes thinner, and that exposes the wall of the stomach to more acid, per se, simplistically speaking. So that creates irritation, bottom line, in your esophagus, in your stomach lining. That's why we don't only, not only if we get reflux, we can also get ulcers in our stomachs, right? Peptic ulcer disease. And all of this is aggravated by, you know, why. You already know the foods that we eat, the drinks that we drink. So as we get older, the coffee, the chocolate, even mint, and of course, fatty foods, processed foods, junk food, unfortunately, make your irritates more your stomach, and also can lead to relaxation of that sphincter, that opening, closing of your esophagus. And of course, medications can also do that. And as we get older, because of our high blood pressure, because of diabetes, etc., we tend to eat more medications, take more medications to control our bodies to stabilize it better. And that can also create problems in your stomach and also in the opening in your stomach. So it's important to recognize the symptoms, and you already know the symptoms because most of us feel it once in a blue moon. Is burning in your esophagus, like having chest discomfort, burning discomfort. Sometimes we tend to have a bitter taste in our mouth because some of the acid goes to our mouth. We may have halitosis, which is your breath doesn't smell as good, unfortunately. We can also have a feeling of fullness or something stuck in our esophagus that makes us feel like something's not moving right. And also, we may have problems with going to sleep because as we lay down, that acid tends to go up. That's a sphincter, that opening is not closing right. We may have more discomfort, and that's why doctors do recommend that you should increase or lift the side of the bed where your head lies upward so that by gravity, that acid goes down instead of upwards. And of course, we can also have, and sometimes scary, it may mimic a heart attack, the type of pain that we can feel in our chest. And that's one most common reason we may hopefully never misdiagnose a heart attack because it mimics the reflux discomfort. And of course, there are other symptoms that you need to keep in mind, but the most important ones I just described. But one of the symptoms that you need to always remember that is dangerous is you should never be vomiting blood. The pain should subside. If it's not subsiding, we need to start thinking of peptic ulcer disease and, of course, our first enemy, right? Cancer. And of course, intractable GERD leads to for us to order a test to look inside your stomach and inside your esophagus, and you're already aware of that. There's an endoscopy for that. But again, we create this by the foods that we eat, the drinks that we drink. I mentioned coffee, I mentioned chocolate, of course, alcohol, etc. Or things that have very citric, like very acidic, can also worsen that. So my talk for today is yes, we have medications for this, but unfortunately, We cannot just be taking medications because every time a tissue gets irritated could, hopefully never, promote cancer in the future. So any type of irritation in your stomach, in any other part of your body, or inflammation can lead to cancer. So it's better just to avoid certain foods or not to eat them all the time. That's my talk for today. And remember my saying, the greatest wealth is health.